Video knowledge, we learn, we shoot, we show. Pharmacokinetics. Introduction to Pharmacokinetics. Pharmacokinetics is a fundamental aspect of pharmacology that focuses on the processes that govern how a drug moves through the body. It can be summarized by the phrase, what the body does to the drug. This encompasses the administration, absorption, distribution, metabolism, and elimination of drugs. Understanding pharmacokinetics is crucial for optimizing drug therapy, ensuring efficacy, and minimizing toxicity. Key determinants of pharmacokinetics. 1. Biological membranes. All drugs must traverse biological membranes, which are characterized by a biphospholipid layer. These membranes have a hydrophilic exterior and a lipophilic interior, making them selectively permeable. The permeability of a drug is influenced by its lipid solubility, degree of ionization, and molecular size. 2. Drug properties. The physical and chemical properties of the drug, such as lipid solubility and pKa, significantly impact its pharmacokinetics. Drugs that are lipid-soluble can easily pass through membranes, while ionized or charged molecules are less permeable. 3. Concentration gradient. Most drugs cross membranes via simple diffusion, moving from areas of higher concentration to lower concentration until equilibrium is reached. Importance of pharmacokinetics. Pharmacokinetics is vital because a drug must reach its site of action in appropriate concentrations to exert its intended pharmacological effects. The concentration of a drug at its site of action is influenced by 4 key factors. 1. Absorption. The process of the drug moving from the administration site into systemic circulation. 2. Distribution. The dispersion of the drug throughout the body compartments. 3. Metabolism. The chemical transformation of the drug, primarily occurring in the liver. 4. Elimination. The removal of the drug from the body, mainly through urine. Absorption. Definition. Absorption refers to how a drug enters the bloodstream. The rate of absorption can significantly influence the drug's intensity and duration of action. Bioavailability. This is the fraction of the administered dose that reaches systemic circulation. The first pass effect, where drugs are metabolized before reaching systemic circulation, can significantly reduce bioavailability. Now, let's examine the different mechanisms through which drugs are absorbed. The majority of drugs are absorbed through simple diffusion, with the rate of absorption depending on several factors. Solubility. The solubility of a drug is influenced by its pH level and pKa. 2. Tissue permeability. 3. Surface area. 4. Blood supply. In addition to simple diffusion, other absorption mechanisms include active transport and facilitated diffusion. Bioavailability, F. Next, we will discuss an important concept known as bioavailability, or F. Bioavailability represents the amount of active drug that reaches systemic circulation and is typically expressed as a percentage of the administered dose. For example, an IV dose achieves 100% bioavailability. Low F values can occur for several reasons. 1. Poorly absorbed drugs. 2. Drugs that undergo significant first-pass metabolism in the liver. Conversely, high F values are associated with IV administration, the first-pass effect. Now, let's address the first-pass effect, which occurs when a drug is metabolized by the liver before it enters systemic circulation. This process results in reduced bioavailability for example, when an orally administered drug is 1. Absorbed in the gastrointestinal tract, GIT. 2. Transported via the portal vein to the liver. 3. Metabolized in the liver, first-pass metabolism. 4. Subsequently released into systemic circulation as metabolites. A specific example is lignocaine, which is used as both a local anesthetic and for treating arrhythmias. When administered subcutaneously, it acts immediately at the target site. However, if taken orally, although it is fully absorbed, it becomes unavailable at the site of action due to metabolism by the liver before reaching systemic circulation. Distribution. Definition. Distribution is the process of drug dispersal throughout the body fluids and tissues. Volume of distribution, VD. This concept helps in understanding how extensively a drug is distributed in the body. A higher VD indicates more extensive distribution into tissues. Plasma protein binding. Many drugs bind to plasma proteins, which can limit their distribution. Only unbound drugs are available for therapeutic action. The journey of a drug begins the moment it enters the bloodstream. Our primary concern is to evaluate how effectively and in what quantities the drug reaches its intended site of action. This process is not only complex, but also influenced by several physiological factors. Major body fluid compartments. To grasp the concept of drug distribution, we must first recognize the major body fluid compartments. 1. Plasma, the liquid component of blood that carries cells and various substances. 2. Interstitial fluid, the fluid found in the spaces between cells, providing a medium for nutrient and waste exchange. 3. Intracellular fluid, the fluid within cells, crucial for cellular functions. 4. Transcellular fluid, specialized fluids, such as cerebrospinal fluid, that occupy specific compartments. 5. Adipose tissue, a storage site for lipid-soluble drugs. 6. Brain, a unique compartment with a protective barrier affecting drug entry. Factors influencing drug movement. Across membranes. Several key factors influence how drugs move across biological membranes. Lipid solubility, lipophilic, fat-loving, drugs can easily pass through cell membranes, while hydrophilic, water-loving drugs face challenges in crossing these barriers. Blood pH and drug pKa. The ionization state of a drug, influenced by the pH of blood and its pKa, determines whether it can pass through membranes. Charged drugs are generally unable to diffuse across lipid membranes. Protein binding. Drugs can bind to plasma proteins, limiting the fraction of free drug available for distribution. Only unbound drugs can diffuse across membranes. Acidic drugs, such as many antibiotics, predominantly bind to albumin, influencing their distribution. Regional blood flow. The amount of blood flow to specific tissues affects the speed and extent of drug delivery, emphasizing the importance of circulation in pharmacokinetics. Volume of distribution, VD. The volume of distribution is a critical parameter in pharmacology, representing the extent to which a drug disperses throughout the body. It is calculated as VD equals A divided C, where A is the amount of drug administered and C is the concentration in the blood. A drug that remains confined to the plasma will have a VD equal to the blood volume, while one that distributes throughout the body will have a VD reflecting the total body volume. Drugs with a high affinity for tissues will exhibit a VD greater than total body volume. Understanding volume of distribution is essential for calculating the initial loading dose, DL, required to achieve a target steady-state concentration, CSS, given by loading dose equals volume of distribution multiplied by steady-state concentration. Multi-compartment model. The distribution of drugs can be described by a multi-compartment model. Drugs transition from the bloodstream to various tissues, similar to how nitrogen is absorbed in divers, preferentially accumulating in adipose tissue. As blood concentrations decrease, drugs can migrate back into the bloodstream, demonstrating the dynamic nature of drug distribution and emphasizing the significance of VD in these processes. Plasma protein binding. In the bloodstream, drugs exist in two states. Bound drugs. These are attached to plasma proteins, limiting their availability for therapeutic action. Unbound/free drugs. These can exit circulation and distribute into tissues, highlighting the importance of the balance between bound and free drug fractions. Depots. Certain body compartments can serve as drug depots, storing drugs with a higher affinity than surrounding tissues. For instance, adipose tissue acts as a reservoir for lipid-soluble drugs like diazepam, allowing for gradual release and prolonged effects. Barriers. Finally, specialized structures such as the placenta and blood-brain barrier selectively limit or prevent drug diffusion. Understanding these barriers is essential for drug development and therapeutic strategies, especially in conditions requiring targeted drug delivery. Thank you for watching the video. If you enjoyed it, don't forget to subscribe to our channel and hit the bell to get updates on new videos. We are excited to share interesting and new content with you, and your subscription helps us keep creating. See you in the next video.